Welcome, everybody. This is Matt Seafold, Executive Vice President here at MedEvolve, an effective intelligence company. Today, we're going to talk about reducing the need for back office staff by fixing the financial clearance process. So many times I walk into organizations and I start asking questions around denials. And one of the things that has always amazed me is the amount of denials that are preventable by just basic financial clearance processes prior to the service date. So first, let's define financial clearance, right? It's the verification of benefits and eligibility. It's also making sure you verify coordination of benefits, which primaries, primary and secondary and tertiary, et cetera. It's also verifying demographics. Now, let me make a point here that you need to get an email address and you need to get a phone number, a mobile text phone number, because people, patients, we all in this world now want to be communicated to in a digital fashion. Okay. Get those data points when you verify demographics. Estimating the patient liability and collecting at least a deposit, getting a credit card on file at a minimum, potentially a payment plan if needed. But let's also collect prior due balances from the patient you're about to see. I can't believe the millions of dollars that keep coming in to our clients that were prior due balances. It's like you keep seeing people for free. Half the dollars coming from the consumer now. It's going to get worse. You got to collect prior service, right? As the economy starts to get shaky, the last bill that gets paid is the healthcare bill. So you got to get what you can before you deliver the service. Okay. The last part is important. It's Precert Referral Off. Is it required? If so, get it. Right? I can't believe the number of no authorization denials that I see. The average net collection rate that I'm seeing right now across our clients when a no-auth denial comes through is 72%. Benchmark should be 97%. Think about that. So let's talk about the impact of front office denials and poor financial clearance processes in the back office. You got to have more people. I was on site with a client yesterday, and we were talking about how to reduce labor cost. And I said, well, the first thing to reduce labor costs is make sure that you're doing everything possible prior to service so you don't need people calling insurance companies or following up with patients. It seems simple. Why is it so hard? It's hard because PM systems, there's not a single practice management system on the market today that captures the required structured data necessary to hold people along the entire revenue cycle accountable for effectiveness. It's bottom line. I've been at this 22 years. I've designed 4 workflow automation systems that bolt on to the inadequate PM systems in this market. Okay. So you need to make sure that you're able to capture and hold accountable all of the actions that are being done, or what I call work effort, to clear patients financially prior to service. And when that doesn't happen, you got to make sure that the back office teams are also held accountable for the effectiveness of getting that AR overturned and paid. Okay. So in closing, if we can focus on front office pre-registration, prior to service financial clearance, you will reduce your labor dependence on the back office. It's as simple as that. And I don't think anybody listening to me right now is having fun trying to find people. It's hard, high turnover, cost of training, cost of hiring. Everyone wants $2-3 more an hour or more, right? So we don't have the luxury of that, right? We don't have the luxury of just throwing bodies at problems anymore. Margins are already under pressure. Okay, so let's do it right on the front end. Most importantly, let's get a workflow automation system that bolts onto your PM system that actually gives you the data necessary to hold people accountable.